All right. Hello, everybody. My name is Bianca Schmidt, and I'm the president of ANGS for this year. Today is our panel for what graduate degree is right for me. And we have some amazing panelists here today to share their experiences on the different kinds of or the degrees that they have and what they've been able to do with those degrees and the kind of careers they've been able to lead and maybe what some of their coworkers and peers and are able to do with their degrees as well, and answer any of your questions about what opportunities are out there for you and what kind of degrees you can pursue and what that will entail. So I will have each panelist introduce themselves. I'll go in an order of how they came into this meeting, and I'll call them out, and then as questions come in, we can be more specific. But if our panelists could introduce yourself, share what degrees you have, and a little bit about your history and your career, what you've done in your life as a nurse and as a faculty member as well, and all that jazz. So we'll start here with Dr. Divin as you've come first, and we'll get started.
Hi, everybody. Thank you so much for this opportunity, Bianca. I so appreciate that and being here with all of you. I've been a nurse for many moons, I would say since 1976, so over 40 years. My nursing career has opened so many incredible doors for me. I worked in ICU initially, pediatrics, a lot of then community health. I volunteered at some clinics for migrants in Houston early on, and that led me to want to go to Latin America. So my family and I went to Latin America. My nursing career took me to Venezuela, where I lived and worked in a barrio, worked with health promoters for 7 years in Barquisimeto, Venezuela. It was there that I think the seeds were planted to go back to school and become an FNP. I had met an FNP, family nurse practitioner, when I was working in New Mexico in ICU in 78. And I remember she was working in the rural communities out in New Mexico. And I thought, this is so cool. And so those seeds were already planted. And then I saw what happened, in Venezuela when people didn't have access to care. I worked a lot with health promoters. I used this book called Where There Is No Doctor and the Merck manual. And I did a lot of what was kind of nurse practitioner work, kind of critical thinking, figure things out, and being there to work with health promoters. I then moved back to the States and the US and lived along the US-Mexico border for 15 years. In El Paso, it was there that I decided to pursue my FNP, and I got a master's in community health nursing while I was working with health promoters in Ciudad Juarez in Mexico. I worked in the colonias in El Paso as a new FNP, and then I worked in geriatrics at a program for all-inclusive care for the elderly. And I never knew that I would be so jazzed about working with this incredible frail elderly population, but I worked in end-of-life care. I helped establish a comfort care program as a family nurse practitioner, got a certification as advanced hospice and palliative nurse. But it was during those times when I started meeting women that were affected by partner violence. I had worked with them before in Latin America as well, but that led me to want to pursue my PhD, brought me to UT, did my dissertation on intimate partner violence in frail aging women and looked at how they healed from that experience, and then became FNP faculty, and now I work as a FNP program coordinator. And I'm just thrilled to be a Longhorn. It was like a lifelong goal of mine, and yeah, I guess that's enough for now.
Thank you so much. Rich history. All right, so next we have Dr. Horton.
Hi, Shalonda Horton, and I've been a nurse since 1995, and that was not my first choice. I started off pre-med at TCU, but coming from humble beginnings, my parents said I couldn't stay there. That was too expensive. And I said, but that's where God wants me to be. And they said, well, you and God better figure it out. My roommate was studying nursing, and my best friend was in the ROTC program. And at that time, they had a big push for nurses were needed in the Army. So I applied for a scholarship and got it, and I didn't look back. I said, this is where I'm supposed to be, nursing. So I have my bachelor's, master's, and PhD in nursing. And never say what you won't do. I said I will not go into oncology, and the Army, Uncle Sam is really my boss. They put me in oncology. That was my first assignment, but I loved it. It really helped me grow as a leader. I was very timid, and so the Army really brought out some untapped potential in me. I got the opportunity to then move into same-day surgery, and then I went to Korea and got to do inpatient psych. And then when I got back to the United States, I went into PACU. Never heard, what is PACU? But that's where I found my little niche. That was I was like, ooh. You think I would have known that since I was in same-day surgery receiving patients from PACU? It just didn't click. I was like, oh. But it just proves that we're always growing and learning. And in PACU, I was taking care of patients that were hard to extubate, and I was trying to figure out upstream, like, how do you prevent that? Why is it hard if they're a smoker, or if they're obese, or, you know, a lot of chronic illnesses? And someone said, you need to go into public health. And so that's how I got into public health. And then I started wanting to get involved into public health programs and research. And so that's how I went back to get my PhD and be able to collaborate with other researchers. I've had the opportunity to serve. Now, if you're considering military, I'm Army. There's many ways to go about going into the military, but I'm a hua kind of girl, so that's me, Army. Haven't jumped out of airplane, but I will if they push me out. But I like being funny, but my husband says I'm not, but I'm trying. But anyway, I've really enjoyed my time in service. There was a point when I did my 8-year commitment to pay back my time for them paying for me to go to school. And I was ready to become, quote, normal and start a family. And I submitted my paperwork to resign my commission, because as an officer, you have to resign your commission. And about 3 months after I submitted my paperwork, 9/11 happened, and they said, denied. I was like, what? And they said, you're an essential healthcare service person. I said, you really are my uncle. You really are the boss of me. But shortly thereafter, I got selected to go to a leadership conference. And at that conference, I got to hear from a 2-star female general nurse. And she wasn't a commander of a health division. She was over like infantry people. I was like, what? So it was so cool to see nursing and leadership. And she reminded me why I signed up in the first place. So here I am, about to retire in January of next year. And it's bittersweet. I'm going to miss it, but I have gained so much experience. That's even how I got into teaching, being able to teach soldiers emergency care before they went overseas. And so I'm gonna miss it, but I am ready for my next chapter in my life. But I don't regret not one experience, both positive and negative, in it. So, and that means I went and looked. I said, well, who have been my commanders in chiefs? So I've served under, from President George W. Bush to President Clinton, President Obama, and President Trump. And I'm going to close with 2 weeks under President Biden. So I'm excited about that.
Thank you so much for sharing your story. All right, next we have Professor Murphy.
Well, my starting story isn't as exciting, but I am a UT grad. I did the traditional BSN program at UT, and then worked in maternity. I've only ever done maternity. That is my jam, like I tell my students. After a while, we would get students on the unit that would come in clinical rotations, and I'd have them under my wing, and I just realized that I love teaching. I was avoiding teaching. Teaching is in my family. My parents, all my family said, no, don't go into teaching. So I didn't. I went and became a nurse and ended up in teaching anyway, because it really was a passion of mine. So I went back and got my master's degree to be able to continue teaching. and came to work at UT. It's been 8.5 years now. And during that time, I have decided that I really do love teaching, and so want to continue doing that. And so I'm currently working on my PhD in nursing, really focusing on maternal outcomes, especially among Black and women of color. And I also am I got a new leadership role as the foundation year coordinator this year. So bringing in my background and experience into the AE program. That's all I have to say. My story is not too exciting.
Thank you so much. All right, Dr. Delville.
Hi, and thank you, Bianca, for asking me to come today. Mine's a fairly convoluted pathway here to Texas. I entered nursing with a diploma in 1975 and proceeded to focus on critical care, cardiac high-risk patients, and eventually cardiac transplant and cath lab directoring. I loved it. And then I found the love of my life, and we came to Texas, and I discovered my 15 years in the VA wasn't going to keep me in critical care. And the University of Texas had an RN to BSN program. And I went straight through to my BSN, having been a diploma, to my PhD over the next few years, because I discovered that my focus in cardiology really needed to develop. And because I was so focused, I went for the clinical nurse specialist role. It's one of the 4 advanced practice roles. It allowed me to focus specifically on cardiology. And I picked up rehab, which meant gerontology along the way, only to discover I had a brand new passion. So my clinical practice focused on geriatrics and rehab, long-term care settings, and high and skilled nursing settings. They're some of the most complex cases I've ever managed. It's not unusual for them to have 10, 12 diagnoses, 20 more meds. And often most of their symptoms are related to the number of medications that they're taking. So it really takes someone who can tease that out rather than trying to treat side effects with yet another medication. Along the way, I discovered that passion for teaching, very similar to what you've heard with the others. And I was very fortunate to be offered a position on faculty in the clinical nurse specialist program. And I'm now directing that program. Our students work primarily with the specialist. So when someone says, what's a nurse specialist? Well, you go to your GP for your routine health, and you would see a nurse practitioner in that setting for a very broad number of diagnoses. But a clinical nurse specialist, you're going to see with a cardiologist or a nephrologist or the endocrinologist. They think of those specialties, and that's where you're going to see the CNS. But we don't just work with patients. We're focused on the nursing and the systems areas of impact. So you'll see us in hospitals running programs or directing nursing education or supporting the nurses with quality improvement or research projects. So there's a lot of different paths which fit my role perfectly, because I wanted to make nursing practice better, but I wanted to keep in practice and I wanted to teach. So I got to fill my plate with like Thanksgiving dinner with a little bit of everything.
Thank you so much. I love that analogy. All right, Dr. Hernandez.
Hello, everyone. Thank you. I'm glad to be here. My name is Janice Hernandez, and my career in nursing started in high school. I started off as a certified nurse aide working in a long-term care center at the age of 16. So I worked there for a couple of years, and then I became a medication aide, which is I started administering medication at that long-term care center that I worked for. And that was also my first introduction into nursing and seeing what the nurses did in the long-term care center. So I decided to get into nursing school, and I went to ACC, and I received my associate degree from ACC and started working at Round Rock Medical Center right after I graduated. and also started the RN to BSN program at UT right after ACC. I was one of two nurses administering chemotherapy in Round Rock Hospital on the med-surg floor, and did that a couple of years. Then I decided to transfer to North Austin Medical Center, where I started the orthopedic floor on 4 East at North Austin. So working there a couple of years and moving the trapeze, the CPM machines, and it was a lot of work, and I decided I wanted to become a family nurse practitioner. So I applied to the FNP program at UT and got in. So I graduated in 2009 with my FNP and started working, and I was about 3 months into working as an FNP, and my grandmother became very, very ill with Lewy body dementia, so I became a caregiver. So I took care of grandma for a couple of years, and during that time, I opened up a small non-medical home care company for hired caregivers and started working my home health company and supplying caregivers to care for their loved ones at home. So I was doing that and doing very well, and I got a call from a very good friend of mine, Dr. Goldstein, who we used to give chemotherapy at Round Rock Hospital, and asked me if I was interested in a teaching position. And I had never taught before, but I did a lot of preceptorship throughout my nursing career. And I said, well, let me try that. I had 3 kids at the time, and I thought that'd be perfect to teach during the day and be off on weekends, holidays with my children. So that was 2014, and I've been there ever since. And then UT started the DNP program. And I said, well, that's perfect. I've been in school so many times. I said, this is something I'd really like to do. And I was very fortunate to have been accepted into the DNP program, and I graduated in the first cohort. So with that DNP, I believe it opened the doors for what I'm doing now, which before was really focused on students, and now it's also focused on faculty and assisting faculty with their goals and moving up in the career ladder within the teaching career. And now I am division chair of the adult health division here at the UT School of Nursing. So that's kind of my quick trajectory.
Wonderful, thank you so much. And Professor Gustafson, thanks for coming and joining us.
Sure, hi there. Let me, hold on just a second. Close the door.
Please, if anyone comes up with any questions, go ahead and send them in the chat box, and we'll be sure to ask them.
Okay. Well, hi there. My name is Tatyana Gustafson, and thank you so much for inviting me to talk to you guys. I love career planning, career thinking. What do you want to do with yourself? I am a graduate of the alternate entry program at UT. Let's see, 2003, it's kind of a long time ago now. I completed the adult health CNS at that time, and after I graduated, I went on to teach clinical groups over at Brackenridge, and I also started working in neurosurgery. So I spent a handful of years doing some pretty intense work with the trauma group as a clinical nurse specialist at Brackenridge. I had always known that at some point I would meander my way back to mental health. I got my undergrad degree in human development and marriage and family therapy, believing I would graduate and go on to become a therapist. I didn't like it. I didn't like the coursework in my undergrad degree, and that's kind of what funneled me towards nursing. I wasn't quite sure what I was going to do with nursing. But it just turned out, as I worked in a really intense trauma setting, that it just kind of all came back up that I really wanted to work in mental health. I preferred the idea of long-term therapeutic relationships with people as opposed to the very high-intensity technical relationship I had in neurosurgery. And right about that time, Stella Logan had just opened, had just started the psychiatric nurse practitioner program at UT. So I went back to school. I completed my psych NP and then worked in private practice for a few years. came back and started teaching in the Psych NP program, and I continue to have a private practice at a nurse-owned clinic. The woman who owns our psychiatric clinic I graduated with from the UT Psych NP program. And so we hire in a delegating physician who comes in once a month and has a meeting with us. And there's 7 of us, 7 nurse practitioners that work there. And it's a great, really supportive environment. And we do indeed collaborate quite a bit. It's really worked out, I think, exactly in the vision that Jessica had when she started it. And then I also teach Psych NP students. That's it. I do some some expert witness work for the Board of Nursing. I feel like that's given me really good insight that I often can share with students about, practice and how psychiatric practice is evaluated by the board, and who can practice psychiatry and who cannot, and those kinds of very intricate questions that I think come up around career and what to do with themselves. And a lot of what I end up reviewing for the board is non-psych specialists who are practicing psych. And I look at their notes and their education and try to figure out if they are indeed practicing psychiatry up to standards. That's it.
Great, thank you so much. All right, Dr. Carter, thanks for joining us.
Thank you, Bianca, for inviting me. So let's just be honest about this. I am not Texan by birth, so the University of Texas was never on my radar. I am a small town girl who's a farmer's daughter out of North Central Indiana. And when I was in high school, my dad said that if I wanted to go to college, I was going to have to get a full-time job and not just work in the fields. So I took a job at the local hospital and became a CNA. And it was really fun, but I still didn't know what I was going to go to college for. I just know that I just wanted to go to college, and I wanted to be the first in my family to get a degree. And one of the nurses said, Sharon, because that's actually my name. She's like, do you like what you do? And I was like, yeah, it's super fun. She goes, well, why don't you go to nursing school? Okay, I'll apply. So I applied, and it was just the best thing ever. Everything clicked and made sense for me. But at the same time, because I was working in a hospital, I was like, nope, don't like that area. Nope, don't like that area. And then our final class in my program to get my BSN was to do a critical care class. And I got cardiovascular intensive care. And it was the most fascinating thing ever. And there was a situation, I won't tell you the situation because that's a whole story in itself, but it just certified to me that that's where I wanted to be. And so I started working there straight out of nursing school. I was a cardiovascular ICU nurse, and I did that for many years. And then I started to feel burnout about 8 years in. I needed something different, but I still wanted to be a nurse. But at the same time, while all this was going on, nursing professors have this way of every time you're in nursing school so when are you going to go back and get another degree? When are you going to go back and get another degree? And I'll just be honest with you, I was the girl in class going, it is not going to be me. Will you just give me my degree and leave me alone? And that was my whole thought. But then when I was working as a nurse, I don't know if it's because at the time I didn't really know. But I actually went to a small private university to get my nursing degree because it was close to my parents' house, so I could live at home and go to school. When you're trying to figure out how to pay for school, that's really important things to consider. But my professors were always very supportive. And I started working as a nurse. I encountered a different school of nursing, and I would see these students just cry every single day because they just felt like they didn't matter. And it just made a really strong impression on me. I mean, how do you teach compassion if you're not showing compassion to students? And it made me say, okay, I want to go back. But in the meantime, I ended up travel nursing. I've been a neurotrauma nurse, but critical care is always where it's been for me. But then I got a master's in nursing education itself, and I started working at UT because by now I lived in Austin, Texas, and I was like, well, I'll just go work there, maybe. And I did, and I love teaching. I love making certain that students understand not just their role, but the impact on patients and the families. And, you know, those little minute details that you sometimes don't recognize, but those minute details can change everything for that patient, and the engagement. And because I love teaching so much, I wanted to merge my worlds of critical care and nursing ed, that I got my DNP from UT, where I did merge those worlds. That was my whole project. It was focused on simulation and enhancing a simulation activity for students. And then since I've gotten the DNP, I have become the director of the Leadership in Diverse Settings graduate program, which is, I don't know, I just pinch myself because it's amazing to me that not only do I help teach students how to become nurses, but I get to help guide them in becoming powerful nurses that can help invoke change in not just nursing, but in healthcare for so many people. And that's my little story.
Thank you so much. I really appreciate it. Okay, Dr. Key, would you like to share your story? Thanks for coming with us and joining us.
Thank you for inviting me, and I apologize for my tardiness today. I knew I had something to do at 12, but I couldn't quite remember what. So I was one of the alternate entries back in the 90s when the program first started. I think I was the third or fourth class of alternate entries. Got out of undergraduate with a different degree and didn't quite know what I wanted to do when I was grown up. So nursing, I got drawn into nursing after working in a hospital setting, doing EKGs and just being around healthcare. I realized that that's what I wanted to do, but it took me, 4 years of college and extra time to figure that out. So while I was in the alternate entry program, I really thought I was going to do geriatrics, and lo and behold, I got into my pediatric rotation and I got turned around to the other end of the spectrum, that I realized that children are my love. The semester I was supposed to graduate from the alternate entry program here at UT, I decided I really wanted to be a nurse practitioner. And at that point, they did allow people to apply. Just a select few were selected to transition from the alternate entry into the PNP tract, and I was selected. So I postponed graduation and stayed at the school for 2 more years and became a pediatric nurse practitioner. I have no regrets. I love what I do. I was hired by a local private multi-specialty clinic here in Austin as a new grad, and I still work for them to this day. Very, very part-time now, but I still really engage in patient care, and I think that's important to bring us back to bringing things to the forefront for students, but also just, maintaining current practice is important. And then someone asked me from the nursing school to come teach a course 17 years ago because they had someone leave, and so I taught a course, and here I am 17 years later, the director of the PMP program and now the chair of the advanced practice division. So I kind of did it the way an alternate entry can do it. You have experiences and you don't know quite what you want to do and you want to change, and you can do whatever you put your mind to. I love what I do, and I hope that comes across as that, that's important to love what you do. And when I look for students, I saw in the chat someone asked about NP programs, what we look for. I can't speak to all the NP programs, but one of the things that I know that we look for in our programs is someone that understands the role of the advanced practice nurse, that you understand the scope of practice, that you understand kind of what you would be doing getting into that career. And certainly we do function in a role that's similar to a physician, but we're not physicians, we're nurses. And we still practice nursing, but we do have that ability to, make diagnosis and manage patients too, but the nursing is still forefront as an advanced practice nurse. So when we look for people in our programs, we want to find someone who understands that and knows that they're going into this field to continue to be a nurse, but at that advanced level, that we're not training you to be doctors, we're training you to be advanced practice nurses. So that's one thing I feel like we look for, is that goodness of fit and someone who has that passion that this is what they really want to do. I think that's it.
Thank you so much, Dr. Key. And we also have Meera and Allison here in our panel, and they work at the Career Services Center here at the School of Nursing. And I'd like to open the floor to them to share anything that they're able to offer, any guidance for anyone curious about what graduate degrees they're interested in.
Yeah, thank you very much, Bianca. So most of you probably know Meera and myself by now. I know we've introduced ourselves many, many times. But yes, I'm Allison. I work in our Career Services Department alongside Meera. And I do not have a nursing background. I went to school to be an elementary school teacher. But I have been at the nursing school now for about 3.5 years in this role. And so for both Meera and I would say, resume writing, cover letter writing, mock interviewing, things of that nature are probably more our strong suit. And we work a lot with both undergraduate and graduate students. The graduate side of things is something we are constantly striving to learn more about, more opportunities, because it differs greatly from what our undergraduates are interested in. So this panel today is helping us tremendously so that we are able to help you as well. So it's been so nice hearing about all of you, because I know you, but I don't know your background so much. So it's been so interesting and very impressive listening to all of them. So yeah, any questions or anything we can do to help you, please feel free to reach out. And if we don't know the answer, we will certainly either try and find it for you or to connect you with somebody who knows better than we do. Meera?
Allison said everything that I was thinking, but definitely reach out if you want help looking at your cover letter or resume. I know jobs are going to start, especially the residency programs are going to start opening soon for the summer. And we'll be happy to help you kind of navigate that.
Thank you so much both for being here. I know they're a great resource and I've utilized them myself and have had great success. So I'd also like to open the floor to expand on what Dr. Key was talking about, the difference between APRNs and doctors and DOs, MDs and DOs. And so if any other APRN would like to share what they know about the scope of practice that they have. I know we had Dr. Delville talk about the scope of practice of the CNS, but I'd like to open the floor to talk about the differences between nursing and physician practice.
Well, I'd just like to say that, every now and then we get, I'm not sure, I don't want to use the word accused, but of like wanting to be mini doctors. In various states, I think it's 30 now, advanced practice nurses have full practice authority. That's not so in Texas just yet, but we do a lot of those things, as Professor Key or Dr. Key was saying, in regards to diagnosing within our scope of practice. Never wanted to be a mini doctor, always so excited to be a nurse and an advanced practice nurse, because I think we bring such incredible gifts to the profession of the advanced practice nurse. We bring our nursing role, that we learned so well, as registered nurses, in health education and compassion and being there for our patients and their families and being an advocate and a leader. And so then we bring these advanced skills as advanced practice nurses. So it's really a cool deal. I would like to say that for FNPs, ours is lifespan. So every now and then we'll get folks that, will become part of our FNP program as a postmasters, because maybe they've been a pediatric nurse practitioner or a clinical nurse specialist, but now want to focus more on lifespan or want to be able to see patients from birth, pregnancy, birth, as children, all the way through to aging adults. And so, you know, I see that happen some. It is like a huge, I mean, lifespan covers a lot. So you have to learn a lot about a lot. And, you know, so you don't become necessarily an expert in a specific area, such as like a clinical nurse specialist would, or a psych mental health NP. But we do a lot of work with health promotion and prevention. And I would say that, you know, what Dr. Key said about understanding that role, I think that's super important, no matter which advanced practice route you decide, or if you decide to be a DNP or a PhD, you know, where the focus is more on, you know, research, you know, as a PhD. I think, you know, understanding that scope, that's important because it's competitive, and we look for those things in the problem statement, not the problem statement, your purpose, you know, statement when you apply. Let's see what else. Yeah, we have a lot of applicants that have worked in ICU and will apply and say, we want to keep people out of ICU now. And so I think recognizing that role and, you know, how we can play such a tremendous job in health promotion and prevention, that's super important for the FNP role.
All right, thank you so much. And Dr. Carter, I'd like to hear more about the leads and what it means to be a leads graduate, as it's not an APRN role, but what that entails in the scope of practice that leads nurses can look forward to.
So the LEADS program is focused more on helping you learn how to be that nurse leader. And nurse leaders are not just, if you think about managers and directors, you absolutely have those. But as nurses, just as whether we're staff nurses, clinic nurses, wherever we are leaders. And the leads role is truly designed to be a universal role to teach you how to take that role of a nurse and be that leader in the community and advance healthcare, whether it's advocating for certain programs, or, you know, maybe you want to be the liaison between the family and the patient and the medical staff that's treating them. You want to take that role and take it even further. Or maybe you want to be a nursing educator, whether it be a hospital-based educator, maybe a diabetes educator, or an academic-based educator. I see LEADS more as a universal program to help you learn how to empower yourselves as nurses, and no matter what it is your end goal is. Does that make sense?
That certainly does. Thank you so much. I'd also like to open the floor to anyone that has any tips or advice or little pearls of going into graduate school and what that takes, how we will know when we're ready for graduate school, or how to get through graduate school if we're already in.
I'll just start. I will say, there are times when I hear students say, well, I just know I want to go back to school, but I don't know what I'd want to do. Graduate school, no matter what you're going for, should never be undertaken lightly. You should have a clear goal of what you want to do before you start to pay thousands of dollars. And let's just be honest about this, nursing school doesn't get easier no matter how many times you go back. And I just think that you should have a firm understanding of what you want to do and what kind of impact you want to do before you decide, okay, I'm going to make my application. That would be my number one tip.
I would say do your homework. If you're applying to the nurse practitioner program, go to the nurse practitioner's professional website, look up what kind of roles they are, what their scope of practice, where they're licensed. The same with a clinical nurse specialist. Don't assume you know what those titles mean. Look it up. Look at the Texas Board of Nursing, whether or not they're the state you're planning on moving to or living in even allows you to have full authority or prescriptive authority, or in the case of a clinical nurse specialist, 39 states allow prescriptions Are you planning on going to California where you need to be in the traditional role? Knowing what you want and being able to tell us how that what our program is going to help you get to that goal is key for your personal statement. And as far as surviving in nursing school, this is your dream. So be active, be engaged, contact your faculty, make use of those office hours. Don't be afraid to ask a question or say, I don't understand the concept. Communication as a nurse is key at every level, but especially as a student. And we respect when a student comes forward and says, I'm missing something foundational here, help me catch up, and I promise I will do my best. And we'll bend over backwards for you.
Oh, I see. You go ahead. I want to echo all that's been said and just make sure you have a strong support system, whether it's a significant other, a best friend, parents, siblings. Definitely, yes, ask for help. I think sometimes students think you have to be all tough, and you're human. We are relationship people. You can't get through it by yourself. Tap into your peers, because even though you have that amazing support system at home, they really can't really be in your shoes. They don't know what it's like. They'll try, but I see some of the current AE MSN students in their foundation year. I admire how they've created their own little study groups. Even in a pandemic, y'all figured out how to connect, and that's really important because there's someone else who can relate to what you're going through. And it's okay to cry, and then just dust yourself off and get back up and go. You can't stop. You gotta keep pressing. Let me correct that. You can stop to take care of yourself. You might need to take a break and come back into the program, but then keep going.
Can I just read Ryan's comment in the chat. Can I address that? I say, make certain it goes back to what I said just a few moments ago. Make certain you know what you want to do before you go back again. You really need to have a strong handle on what it is that you want to do. For example, I know people that dreamt about being a nurse. They went through nursing school, they started working at a nurse, and then they hated it. And so, just because you think you know, it doesn't necessarily mean that you really do know. So just be certain that you really know what you want to do, Ryan, and for anybody else who had that question, before you step into a terminal degree. That would be my best advice.
I would agree with you, Sharon. It's important for you everyone grows as they get older and have new experience, and where you think you want to be right now, it can be very different than where you're truly going to be 15, 20 years down the road. So, embracing your life experiences can help you guide you into that next step. Some people know exactly what they want to do, and if going for the terminal degree, that's what you want to do, then that's your individual decision for you. But take that time to kind of reflect on where you're at and where you think you might want to be, and just let your life experiences help guide you along.
Yeah, and I just wanted to add that I think that our patients are going to be our best teachers along the way, as far as like opening up our eyes to like, wow, where do I want to go with this lesson that I'm learning? And, it'll be different for everybody. Like, what you all have already said, some will just like, wow, I'm going to go straight on through, because if I get my PhD early, I'm going to have so much more time to do the research that I'm, excited about doing. Other people, like when I got my master's in my 40s, my advisor said, wow, you should really go on and get your PhD. And I said, are you crazy? I was so exhausted from 2 years of that program. But then, a few years later, I was back, and I've never regretted any of those chapters in my life. But yeah, I just think, just kind of trust the life process, and you'll know when it's the right time for you. And just the toolkit of self-care, someone wrote that in the chat. So the times when I struggled, I had some of my peers say, but nobody's making you do this PhD, Chris. It's like, you wanted to do this, you signed up for it, you know, so get the support you need, because it is hard, it's challenging. And certainly, you know, you don't just get handed a degree. It's a lot of blood, sweat, and tears, but so worthwhile.
So I wanted to just open up. I'm going to have to be logging off here pretty soon. But I just wanted to make sure, are there any questions from any of the students about psych mental health? Since that would be my niche among these fabulous professionals. Before I sign off, I just want to make sure that I didn't miss any questions, maybe specific to psych NP. All right.
Well, even after this, I know you can still reach out to any of us if you have something that comes up later. And I was just going to share one funny story that it's worth the tears. I remember one day I was sitting on the stairs and I was just crying. And my husband's like, I don't know what to do. I'm like, you can't help me. But it's your journey, and it's so worth it. I'm not the same person I was when I started, and I'm grateful for all those challenges. And your faculty really do care. I can remember Dr. Brown, I was in class one day and they just said, how are you? And I just broke down. She's like, go home. So your faculty really do care. So seek them out in office hours. If you can't grasp a concept or something, I cannot stress that enough. When Dr. Delville said, go talk to your faculty.
I wholeheartedly agree with that, Dr. Horton. I don't think any of us are the same as we were in the beginning. I mean, heck, I never even wanted to be a nurse. I just wanted to be Christy Brinkley, which some of you don't even know who she is probably, but that's okay. But that was my whole thing. That's who I wanted to be. And then I ended up a nurse, and then I was never going to get a degree. And now I have 3. God help us all. But you evolve and you change, and those are good changes, but you will evolve.
I think you know you want to go back to school for a degree when the job that you want to be doing, you're being told you can't do it without the degree. And that's, I think if all of us reflect back at, you know, and I was hearing Chris say, well, I went down and there were all these things I was doing in the colonias, et cetera. And she wanted to provide that primary care. She had to have the degree in order to be able to do it. And at some point, all of us got to the point where our dream, our passion in nursing, we had to take our education to the next step. I came back literally for my higher degree after 20 years of being a nurse. And I thought, I know nursing. You don't know what you don't know until you come back, which is difficult because you don't know what you need until that job that you really want to do, that passion that you really have. I'm not saying that somebody coming straight out with their BSN doesn't have a dream and wants to go forward for a PhD and do research. That's their passion. Bless them for knowing what they want so early in life. Many of us need a little bit of experience to inform us of that. And that's why I say, do your research on it. Find out what you need, what you want. And certainly in grad school, for those who are in these programs, I encourage them to work part-time along the way so they can get some experience. It really helps them discover that, just like Stephanie, oh, I wanted Gero, but I really have a passion for pediatrics. If she hadn't had those experiences, she wouldn't have known.
So I was just going to answer a question. Somebody asked a question in the chat room about, do I feel that specializing in psych, I've lost some of my med-surg knowledge? And yes. I mean, the straight up answer is yes. And I think that one of the things about just the world today is it's I mean, we just know so much. So even within psych, I'm starting to be specialized even in psych. So I don't treat a whole lot of people with psychotic disorders anymore. And so I'm even, not in touch with the newest and greatest advancements, even just in psychotic disorders. I mean, my knowledge and understanding of depression and treatment of depression grows every day. And it pushes out other information that I used to know. And I think that's just the process of being a specialist. On the other hand, I do feel like that because I had a CNS background and because I did come to psych, after working in some other specialties, I feel like it does give me a benefit in terms of just feeling more confident in talking to somebody about birth control. I do prescribe birth control to people who have PMDD. I do. I don't worry about it. There are a lot of other psych NPs that I work with that would never do such a thing. But because of my previous education and certification, I feel comfortable doing that. So I feel like my knowledge in areas of, med surg or the non-psych world that apply to psych, like thyroid, pain management, hormones, that stays up because I'm truly using it every day. But I couldn't read a CT scan or an MRI of a lumbar spine anymore, which I used to be able to read quite well in neurosurgery. And I can't anymore. Wouldn't even trust myself to. So that's okay. It's a little sad. I want to know everything, but I can't.
Thank you so much for sharing that. Dr. Carter, if you're still on, we have some question about leads wanting to be broad, and then do we have direction and guidance within the program to kind of specialize if they want to, or figure out what within that huge scope that leads has to offer of where they can find where their passion lies, perhaps.
So if you are an alternate entry lead student, you're still, a lot of students, when they're in that portion, they're still figuring out where they want to go and where they want to be. That will come with time, but as you're moving through, you start figuring those things out. And by the time you really do hit that first full semester of the actual leads portion of the program, we start trying to help you niche into areas that you are interested in. So it is broad, but it does try to help you feel that niche. Does that make sense? Let's see, that was from Erica. Did that help answer her question? Okay, good. And you can always, all of you can always reach out. I am a very good emailer. So if you have questions, you just email me anytime. I'll probably respond within just a few moments, but let's just be honest about this.
Great, thank you so much. And I wanted to announce our raffle prize winners. We have some different raffle prizes, including UT nursing scrubs, generic scrubs, textbooks. We have the Fundamentals in Nursing, the Med-Surg book, the Nursing Diagnosis Handbook to give away. We have highlighters, hand sanitizer, and even one of those portfolio binders. And so I have our winners here. We have Christina Nguyen, Aya Akid, Ching Yao Lee, and Peter Clotter. Congratulations. I put my email in here, so if you could send me either your email address or go ahead and email me, I'll get back to you and we'll get your prizes to you. I wanted to announce that before we finished off this meeting. So congratulations, everybody. And I also want to open the floor to anyone else with any last minute pearls or something they want to share for everyone listening here. Thank you so much to all of our panelists for being here. It's been incredible hearing from all of you.
I would just say, take care of yourselves. You can't take care of other people unless you're taking care of yourself. So be kind to yourself and take care of yourself. you have to do that in nursing, and we're all guilty of it because we give and we give so much in order to help our patients and help our colleagues that it's easy to forget about taking care of ourselves. You're going to be stressed. You're going to want to cry, and it's okay to cry. This is not, there's no crying in nursing. There is crying in nursing. And that's why we have wonderful support systems, because nobody understands nursing the way other nurses do. So that would be my tidbit.
I wanted to say real quick, Tracy sent out a survey yesterday about career services for the spring. Please take a moment and fill it out. It'll definitely help us plan and really make sure we're able to provide you guys with everything you need.
All right, thank you so much. Again, I have listed all of our panelists here in our chat box, so take note of anyone you might want to contact later by email. They're all wonderful and a great, amazing resource to have here. Thanks again to everyone for coming between all of our meetings today. I really appreciate it, and I know everyone here appreciates it so much. So thank you so much for coming, and I hope you have a great rest of your day and you can enjoy some of the sunshine. Thank you.
Thank you, Ms. Bianca.
Mm-hmm.